Kia ora, welcome to Blood, Sweat and Talanoa, episode 13. Blood, Sweat and Talanoa is a podcast about three guys from Porirua talking about a range of things from health and well-being, contemporary issues, sporting war stories, and sharing some of our life experiences and personal journeys. And always looking to engage. So like and subscribe as we look to build our podcast and an audience. I'm with Shane. Also Teho, is away today. Shane, could you please introduce our guests?
Oh, talofa lava, everyone. And our guests for this episode is the wonderful Tagaloa, Dr. Taima Fagaloa. So welcome, Taima. Malo le soifua, lau a whionga, e a whio mai, and really good to have you here with us.
Oh, lovely. Malo le soifua maua ma le langi e mama, talofa lava ki orana, whakalofa lahi atu, malo elelei ni sa pula manaka, taloha ni ki ora koutou. And very warm Pacific greetings. Great to see you both.
No,
Yeah,
good
likewise,
to see you.
Yeah.
Now, Taima, we were going to cover you cover a couple of things through just your background and a couple of things that you've done. But as we always start with our guests, first of all, just a bit of a PPR and background. So we'll turn it over to you.
Absolutely, and thank you. Thank you for the opportunity to collaborate, connect with you all today, and to acknowledge the awesome opportunity that Blood, Sweat and Talanoa have in ensuring we hear some amazing stories that we would not have otherwise heard had it not been for this program. So I've been watching your programs and they're absolutely fantastic. My name's Taima Fagaloa. My mother is the late Malia Fagaloa, ni Peilua, from Malay Malu and Falealili. Her father is Samuelu Peilua, and I'm named after our maternal grandmother, Taima Peilua, ni Ki. My father is Tapuala Faleula Fagaloa, born in Sarelavalu, Savai, of which my title Tagaloa derives from. And then Dad was raised by his mother's ainga from the village of Satapawala, where he was raised by the Reverend Fagaloa Va'ili, and his wife Tofa Fagaloa, who are our paternal grandparents. So, look, I grew up in Wellington City. I'm not a Porirua, birthed in Porirua. I just came to love the city. It's amazing. I grew up in Wellington City, where my parents settled in Wellington, having met each other. The eyes locked at a local PIC SIVA back in the 1960s. The eyes locked across the hall, and next minute they are getting married in the 1960s. After they got married, they lived in a rental property in Shirley Bay where they witnessed the Wahine disaster. So that was around the year that I was born in 1967, or I would have been a year old then, 1968. They then moved to Strathmore Park, where we lived in a 3-bedroom housing corp unit in Wharikoti Street, right at the top, up there, right at the top, with magnificent views of Wellington City. Other families that lived up there at the time were the Samasonis, Martha, Ann, and Sampson, the Cliffords, Paula Masoy, Geraldine and her sister and her brother lived up there, in the Fui Maonos, Machin Huani. We all lived up in Strathmore Park. So it's no wonder that some of us have actually come to live in Porirua, because I guess the community sense of well-being and community were very similar to what we find in Porirua. So that was great. Until the 1980s, we lived there when Mum and Dad had saved up for their own property. They bought a house in Lonsdale Crescent in Rongotai, and that was back in the 1980s. It cost them $33,000. And so it's probably worth about 15 times that now, being in Wellington. And then sort of as time moved on, they sold the house and moved down on the flat off Onipu Road, which is very close to Lower Bay Beach. I have two brothers, Patio and Mary, and our brother David, sister Tofa, myself, and then Tina. Tofa's a nurse, Tina's a school teacher. We attended the local schools, Strathmore Park, Evans Bay Intermediate, Rongotai, Wellington East Girls College. Our parents were part of the Wesley Methodist Church in Taranaki Street and were staunch in their faith, which meant we had no choice but to attend church like many of our our generation until we pretty much started working. Then I suspect they gave up on forcing us as we went out into the big wide world and found more enticing things then, which got us into more trouble. I lived in Sydney after I finished school. I went to Sydney for a couple of years. I guess going to Sydney was an experience for me that aligns to what it's like for my parents to come to a new country. I was lucky I could speak English, but I just got a sense of knowing what the alien sense of feeling when you go to a new country, don't know anyone. They have different systems, and so I got a sense of that feeling when I went to Sydney, Australia for a couple of years, and then I returned and trained as to be a social worker at Victoria University. And not long after finishing, I met my mate Rod in Pororua. We had a son, got married, and then we had a little bit of a break. Just going back to my school days, though, can I really make a point of this, because there seems to be a sense of, you have to, when you achieve at college, you can achieve outside, when you get on with life. That's absolutely untrue. In fact, I failed school C badly. My older sister was the brainy one. She's very smart. When she got school C, first pop, she got 84% for English, which was the highest score for any student to get in school C at that time. When it came to me, I wanted to play sports more. So just to let you know, I did fail dismally at college. I got worse marks when I went back to do it the second year than I did the first year, which was really disappointing with my dad. And then they forced me back to go to UE. But I just think some of us grow out of college and should leave and just start working. So I just wanted to say that it's not the end if you do not pass your school C.
I thought it was just because you went to Wellington East.
Well, hey, I tell you, we played up so much. I'll be honest, we had a little bit of a gang there, and we used to go down the back courts and smoke and, pre-Christmas drinks. We were so naughty. But yeah, I just felt at the time I needed to leave when I did. So that was a really good thing. So when I had David, that was pretty much where everything started to change for me in terms of my career direction. And I know why, because when I had him, I sort of remembered getting up the next morning, looking at him and saying, oh my God, I'm responsible for you for the rest of my life. And that just kick-started something in me. That meant I had to really work hard. So worked at Oranga Tamariki for 10 years as a social worker, and then moved through the different ranks into care and protection coordination, youth justice coordination, then ended up in national office and running what we call the neglect prevention program, which was really important for our Pacific families because our parents worked 2 jobs and often they'd leave the kids at home. And they needed to understand that if they weren't 14 years and over, that would be a form of abandonment. But our parents didn't know that. So my role was to actually go around the country and educate Pacific people on the Act and make sure they knew what, the whole thing around neglect was all about. I then sort of decided to leave Oranga Tamariki, and that's when I went to work for Te Ao Manino Trust. And that was during the time that Ifopo and Paula Mastoy were running the trust. You recall that Ifopo, that was his brainchild, Te Ao Manino Trust. And I did a short stint there as a social work consultant. And then as I left there, I went to Dr. Margaret Southwick, who was running the Pacific Research Unit at Whitireia Polytechnic. And it was at that time that I decided to start my Masters in Social Science Research. I would never recommend going from a diploma to a Master's. That was really dumb. In fact, you should do the undergrad, diploma, bachelor, Master's, and then onwards, because there's so much you learn at all those different levels to help you keep going into the the high level education. So I did my Masters, and it was around 2001 at the same time. I don't know what I was thinking of doing with these things. 2001 that I ran for the District Health Board for Porirua. I didn't get in. So I became a member at the time of the Service and Food Workers Union. And some of you will remember our Highness, Her Highness, the Right Honourable Elizabeth Smith Lee-Law.
Yes, we do.
Yes. Lee-Law family, the Smith family are very much a part of the Porirua, space and environment. Very strong families.
And Taima, she was mentioned in an earlier episode, so definitely.
Oh, gotcha. Oh, you wouldn't, look, what I have to say is that woman, I heard stories about her, but I came to realize, someone had said to me, I think it was John Rao, how she got into unionism was when she was working as a kitchen hand down at Kinapuru Hospital back in the 70s. And it was her boss called her a coconut. So she grabbed the meat cleaver and chased him around the kitchen, chased him, she was so angry. And so they called in the union to come and help with the dispute. And the union said, we could really use someone with your skills. Are you serious? I don't know about that, but she was probably one of the staunchest, Shane.
I don't know if that was one of the qualifiers in giving her a Queen's Service Medal either.
I know that will remain a secret forever, but she epitomizes no fefe. That woman was not intimidated, no matter what level politician she would. I even heard her say things in the presence of the Right Honourable Helen Clark, because she was the Prime Minister at the time, that I thought, man, you can get away with anything. Yet she'd be the first on the list to go over to Samoa during the apology that was done when Helen went back there. So she was, there's a lot of people in our community that our young ones don't know about that have created this pathway of success and developed us throughout the years. And Elizabeth was definitely one of them. But I ran for council on her request in 2004. And so I ran with Letia, and we ran on a Labour ticket with, who else was there? Bud Lavery. Yeah, Bud Lavery. Sorry, I can't remember the other councillor, but there were 4 of us that ran, and 4 of us got in with Letia. So that really was a bit of a turning point. And then it was sort of even either before or after Lua Manuvao started running, ran as the first woman MP of Pacific descent for the whole country, really, and for that whole parliament. So Shane, you were very instrumental in your role and all of that. I really enjoyed coming down at what godly an hour was it, 7 o'clock, 8 o'clock in the morning, down to the local market to help you put up that stall, and we'd be there supporting you to do that. But the Labour space was taken up by a small group of us that were instrumental in just doing stuff behind the scenes, more so behind Shane, because Shane was the key person that was running the show. And it was Shane, Letia, the late Nari Oilua, our good sister Nari, Leala Manua Caroline, and Danny Mariko. And there was a tight group of us that when Lua Manuvao told us to jump, we would say how high, not what if, but you just do what you do what you have to do to support the space. And we also connected with the team in Auckland in terms of the Labour Party. So Carmel, we were there supporting Carmel Sepuloni as well. At the time of all of that happening too, I became the chair of the Ministerial Advisory Council. And it was interesting at that time, and it became a bit public, and there was a bit of media coverage. But we were told, our Ministerial Advisory Council was when Georgina Tehiuhiu was the minister back then. It was a national government, but there was word out that NPP were giving out a $2 million economic development contract, and that contract was going out. And I thought to myself, well, we just had meeting with the minister in the minister's office, and there was no discussion about this contract coming out. And so we thought, we were really concerned about that. There was no lack of transparency, and we decided that we were going to, make it an issue, the council. So we started asking some questions, and we're told essentially it's an operational matter, nothing to do with us. But I thought, well, it does have to do with us, because it's a perception that the council has a responsibility to monitor what the minister's doing. And so in the end, I decided to resign, and I made it quite public that I disagreed with the fact that a decision had been made without. It just felt like we were obviously token. We were there to make it seem that we were connected, that the ministry was connected to the community, but I just felt that we were very token, and in the end, I resigned. It was the front page of the news. It was the time when Sir Colin Tukuitonga was the chief executive at that time, and he was ringing me saying, Taima, and I said, well, actually, no, I'm resigning on principle, and I'm doing it publicly because our community's asking questions. And I think in the end they did it backward. They reversed the decision, but it sort of just highlights the kind of position that a lot of us get into, that a lot of our communities don't know what that happens behind the scenes. So that was a critical time working in that Ministerial Advisory Council space for the Ministry of Pacific Peoples under the leadership of Sir Colin Tukuitonga. So it was really important. The sadness though was probably after serving just on the end of my second term on council, my mum became ill, and she ended up with both breast and ovarian cancer. So I made a call to go back to Wellington and look after her with my brother and my sisters. And so that was a really big turning point for us. She was the sort of the matriarch of our family, middle of 12 brothers and sisters, and she brought the younger 5 brothers and sisters over with their families. And so it was a big deal that we were losing her, but we were very lucky that we had a whole year with her before, it actually happened. So, it was really, really important. I think when I did go back to Wellington, the Director of Pacific Health role came up, so I applied for that. Tina will say that I ended up 10 minutes late to a really important interview, and that's because I went to the wrong building. But Ken Whelan was the chief executive at the time, and I was interviewed, and I was essentially taking over from Lee Pierce, who was going over to Tagaloa to be the director of health there. And Tino Pereira he became the chair of our sub-regional Pacific Strategic Health Group, so I worked really closely with him. While I was just on the same time that I started that job, I graduated with my Master's in Social Science Research, so that took me about 6 years to do. And probably after Mum passed away in 2011, the year after, I actually received some awesome support and advice from Lua Mamavao to consider doing my PhD. And I think that if I hadn't had that conversation with her, because I was thinking, what next? It wasn't as if the director role was busy enough that I was now thinking about, putting
I reckon.
Yeah. Who does that? So I did start my PhD in 2012. And the focus was on Pacific leadership in the New Zealand public sector. So anyone listening who has worked in a public sector or is actually leaving a public sector because of everything that's going in there will understand what my thesis talks about. It talks about the challenges of our Pacific public sector leaders in trying to advocate against a very high brick bureaucratic wall to improve the outcomes for our Pacific people. And so it goes into very thick detail about the type of challenges we face. So I embarked on that journey, and finally finished in about 2022. So it took a good 10 years for me to complete that. But prior to around about 2019, I did decide to leave the health sector because because I needed to finish the PhD. I could see I wasn't going to finish it if I stayed in that role. So I did leave in 2019, and at the time I left, I was reporting to Dr. Ashley Bloomfield. I had left just in time, actually, in terms of the COVID-19. They really did need fresh leadership in there, and I'm so glad that I left at the time that I did, so that new leadership could come in and take that journey. Um, After I left the DHB, I did a short stint with Waka Tautua, being the regional manager across Wellington and Christchurch. And after resigning, I refocused on my PhD. I did some contract work for a national disability provider called Your Way Kia Roha, an amazing service where I did some project work, developed their Pacific strategy, and ran a cultural responsiveness program. And while in that role, there was a point 0.5 senior advisor role that came up at Porora City Council. And a friend of mine brought it to my attention, and I was interested in that role because the ad reflected what they were looking for was a project lead to develop the Pacific strategy. And I'd never thought that we ever had a Pacific strategy. But I also thought that in some ways, this is about putting right what I've always been quite uncomfortable about in the back of my mind, and that if I knew deep back then what I know now about how important a strategy is in influencing a system or a department, I probably would have pushed for the strategy when I was on council. So for me, by doing this, by applying for this point 0.5 role and being the project lead for the development of the Pacific strategy, was about putting right what I felt was unfinished in terms of my term on council, and possibly for many of my other Pacific colleagues that were on council. And as it happened, we were able to not rush, but move at a very swift pace to get that strategy over the line, particularly at a time that governments were changing. So, Olakamatanga was born, Olakamatanga, beginning of life, was born. And now I'm just in there doing some implementation work and working on the monitoring framework. So, Shane, Tiare, that's pretty much me. And I've got a show. How long did that take? Gosh. But
No,
wonderful journey.
look, that's good, Len. But look, what we're going to do now, we'll go back into a couple of those particular areas. We're keen to do a little bit more of a deeper dive with you. So this is awesome. So look, what sort of attracted you in terms of social work?
Oh, look, at college, and this is probably why I failed my subjects dismally. We used to truant, and so we used to find a place in the bush that some of us would go and wear classes. And while we were in classes, we talked to each other about the problems we were having. And someone said to me, Taima, you'd make a really good social worker. But I just sort of thought, oh, what's a social worker? I didn't know what a social worker was. But I think when I got back from Australia, I had two options. I got into a business school at Wellington Polytech, and I got into the diploma in social work program at Victoria. I didn't know which one to take, so I went to Dad and I said, Dad, I don't know which one to take. I've got into both, and he said, you take the one that will get you overseas, that will get you back overseas, a qualification that you can use overseas. And that was, to me, that was a social work diploma because it was a university-based program. So that's how I ended up doing it.
Oh,
yeah.
I mean, what are some of the things you took away, some learnings, and particularly, I mean, I remember you and I have talked about things like supervision, but also in working with high sort of families that are either in crisis or needing quite a bit of support. I mean,
Yeah.
what was some of the things that you sort of took away in terms of some of those observations while working in the sector?
Yeah. One of the biggest things that I feel like I've taken away is the need for families to work through their issues without government intervention as much as possible. The families that came to our notice, I believe, were families that had gone beyond what I would call preventative help and support that government had to intervene. But when I sort of work with families and looked at their pathway and their journey, I always thought, man, if really good intervention was put in a lot earlier, then the outcome may have not been that this family comes to the notice of oranga tamariki. I came away from that job thinking it's quite a depowering system when it comes to working with families. It's easy to get into that system. It is so hard to get out because, one, we don't have enough Māori and Pacific social workers to provide that lived experience and understanding and knowledge around cultural, understanding, cultural etiquette, cultural protocols. There still is a very colonizing system that comes down on our families when it comes to things like court orders and that. And, I just felt like times that families were so powerless in the end to ever be able to undo what it had been done. So I'm all for early intervention and prevention. Family group conferences was an intervention that was used as part of the Children, Young Persons and Their Families Act that I absolutely support. I support it a lot earlier than when that intervention happens. In fact, I see now the family group conference theory is now being adapted into places like Tōrangatira. I think even Te Ao Manino are doing some work in this space because it's a really empowering model to help families, help professionals reflect to families what is happening. Because when you're in it, you don't know that it's happening. You don't know that these family dynamics are causing major rifts because it's all very much emotionally embroiled. But I actually believe that prevention is better than cure when it comes to our young people, our children and young people. It's such a change in direction when a government department has so much intervention in the lives of families.
Do you think things like whānau ora that have provided a better framework with which to actually support families through processes and that? Like you talk about some very practitioner sort of things, but also that framework that also helps in terms of where resources should go, but also where the expertise should be as well.
I agree with you, Shane. I agree with you because whānau ora is community based. It's not located within a statutory environment. And something else that was born out of this whole children, young persons and their families act system was strengthening families. Now, strengthening families was really good because the process was about bringing all the professionals around the table that dealt with this one particular child or young person and their family. Prior to that, we just weren't talking to each other. And so, judgments were made on assumptions or presumptions. Yet when you have strengthening families, you get the professionals talking about the issue together, and then you can have at that point cultural input. But I do agree with you. I think that whānau ora was a great intervention and a great disruption of a system that wasn't necessarily working in favour of the families that it served.
Cool. Now, look, one of the other things, like I know, so your PhD, your doctorate was in sort of that interaction as a Pacific person working in the system and that as well. I mean, a big part of this pod has been around people talking around identity and their journey around their own understanding their own identity and that as well. I'm just interested in terms of your research and your study towards your PhD. What did it pick up in terms of how people sort of either felt an element of tension between their own identity, professional and cultural and personal, and how they sort of operated in a system that necessarily isn't responsive in terms of Pacific?
Yeah, absolutely. Shane, that's a really good question. And so out of the PhD, there were 5 themes. The first one was the most critical in my view because it talked about negotiation, and in my head I'd say as opposed to when you've got to dictate to someone how it should be. So the first theme that came out was a negotiation of Western and Pacific cultural perspectives of leadership. So essentially, I was saying that as I go into the public sector, I take all I am, who I am. I take my identity, I take my family, I take my lived experience of working within the Pacific community. But then there is this door that says, no, we only want these parts of you, and the rest you have to leave at the door. And so, and that's even if you're going to go in and work in a Pacific role, is that gap between the door is even tighter, because I suspect that, you know, the system could potentially be at even more threat with someone that's more knowledgeable about what cultural responsiveness looks like. So yes, you're absolutely right. You know, there needs to be a negotiation, because our outcomes depend on it. We have all these awesome Pacific people going in with the best of intentions, or aspirations and dreams of our people. They go in with there and they come out burnt out. And they come out burnt out because every door that they're knocking on, it's closed or locked, and they can't get through. So, you know, you can imagine, I've got my family, I've got all of my community on my shoulders, and if I can't get through that system or understand how to get through that system, it can be so disheartening.
Yeah.
And so that's what the study looks at. It looks at the devaluing of our knowledge, our cultural knowledge within that system. It looks at equal employment opportunities. It looks at how should the government sector be building local leadership within the New Zealand public sector. You know, it looks at how, you know, safety. You know, how are our people made safe when you think about opportunities to develop networking amongst Pacific staff and Pacific leaders to keep themselves safe. But also, we need our leaders. I mean, my father said to me, I never thought I'd be alive when I would see the Deputy Prime Minister is Samoan Tongan, or the top position in the health sector is of Samoan. Great, it's the woman too. But, you know, we never thought we would get there. It's happening, and it's like brilliant. But it's just as hard for them up there as it is for us down here, because they have they have the whole population that they need to serve. My thing is, you think about Pacific values and cultural protocols and practices. That's good for every family, regardless of what ethnicity you are. When you think of collaboration, when you think of collectiveness, when you think of communal living is about sharing. You know, there's a concept called inati in the Tagaloa community, which is the equitable distribution of resources for communities and families, so that those who need more get more, and those who don't need so much, you know, get a little bit less. But ultimately, you know, it's about making a fair analysis or approach to giving resources out. So, you know, I think there's so much that mainstream can learn from Pacific culture, from the way we operate. I think our challenge is how we retain that knowledge, given the generations. You know, my father's generation, he's 87 now, and, you know, that generation with all that intrinsic knowledge brought over from the island, that generation's now going. So we're in a bit of a speed to try and make sure we are retaining that knowledge.
Yeah. And well, look, that's one of the things that's always, and probably this is a good segue into the health area. Like we talk around retaining knowledge. One of the things that we've talked about in a previous episode too is our longevity. So the stats in terms of health have us dying a lot earlier than either the rest of the population in general.
Yeah.
And so you lose an element of a lot of that knowledge in that as well. So I guess in the health sector, what did you find the most challenging in terms of, one, your role as in terms of Pacific and being a senior executive as part of the DHP for Capital Coast? And what were some of those observations over that time, and particularly coming from an NGO background as well?
Yeah. Look, thank you for that question, because I think that's a very good question. So I went into that role feeling really out of my depth, to be honest. I thought, oh, this is just too, you know, I wouldn't be able to succeed at this role. But the Ken Whelan, who was the CEO that employed me, he said, Taima, your role, you are a conductor in an orchestra. This hospital is your orchestra. You are the conductor. It is your role to conduct some good music from this orchestra. And I never forgot that, because it made sense to me that I needed to influence the system. And I actually believe that relationships are critical to influencing systems. If you think about Leslie Law and the way she used to go in and, really, she used to go for it, eh? She was firing it all. And often, sometimes that would put people off, sometimes that would work. But for me, I'm more of a softer type approach to this kind of stuff. As a social worker too, I believe that if you're building those relationships, that's important. So I want to go back to that point you made around our hospital admissions. Yes, every time we go to that DHB, every time we go to ED, they are counting us. And what they could tell me when I was in there was our ED admissions are avoidable, and our ED admissions are this much, and of this much, for the 0 to 5s, it's this much. And then they can tell me what are the top 5 health conditions of the Pacific children aged 0 to 5. And they told me at one time, Taima, it's dental. These kids are coming in to our dental service, and having their teeth removed. And, at the time, I've had a child. I know how important it is for David to, look after his teeth. And in my head, I was going, I can't believe what I'm hearing. I can't believe what I'm hearing, because these children have just been born. How on earth do they get all these dental caries and get teeth removed at that age? So we started to dig a bit deep, and I asked Ricky Nenia, who was the Māori director, to partner with us on this. The data we got that year, and I think it was 2012, was that only 17% of Māori children enrolled within the district health board were accessing dental services. So we've got a Be Healthy service that works for children 0 to 5. And there was only 17% of the Māori children 0 to 5 that were enrolled in the Be Healthy service. For Pacific, it was only 16%. So you could see that because they weren't part of the Be Healthy service, no one's looking out, no one's monitoring their teeth, no one's giving the parents education, and bang, they're ending up in ED. We ran a significant program, and it involved people like Caroline Mariko with Pinikilicious. We engaged the Pacific radio program. We partnered with the Be Healthy system, and we partnered with the GP services. So let's take Waitangiroa GP service that you'll know back then, based up in Waitangiroa. So I went with our Be Healthy service lead, and we had a meeting with them. And so they've got an IT system, they collect data, and the hospital has got an IT system, and those systems don't talk to each other. So we said, okay, how about we do a cross-referencing on both IT systems to find out where the gap is? In 1 hour, they found 300 children enrolled at Waitangiroa Medical Centre that weren't on the Be Healthy database. So what we did was we wrote to those parents and said, look, we're going to enroll your child automatically. If we don't hear from you in 2 weeks, we're going to automatically enroll them. By 2016, that 16% went to 84% enrollment.
Was that, like, you've talked about the approach in terms of getting people connected to it? Prior to that, though, what was the failings of that to be able to do that? Because it obviously wasn't that the parents weren't going to take up the service because they didn't want it. Or was it just really interesting?
Yeah, I think that's a really good question. So we held a community meeting, and we took out the clinical leads of the dental service, and it was happened to be this senior clinician where him and I sort of knocked a bit in terms of we clashed, because his view was that there was a bit of victim blaming, that it was our people's fault that the children weren't coming. I said, well, I disagree with you. I think that you're being paid a lot of money. Your service is well funded. You actually need to employ Pacific people, Māori and Pacific people who can do the outreach and have the connection with the services and with the families. And there just was no understanding or acknowledgement or acceptance that that was the case. Things didn't change, Shane, until, I'm sorry I forgot her name, they appointed a director of Māori descent. And all of a sudden, you see the numbers go up. And because the numbers went up, the enrollment numbers went up, because these kids had to be, all these kids that weren't seen had to be examined. So supply needed to meet demand. And they were able to keep the arrears rate down to 5%. So we went from 5% arrears to ensure that all the Māori and Pacific children that was all of a sudden suddenly enrolled were able to be seen. And I just think that that happens a lot in different places. And if anything, that example taught me the importance of how we monitor systems, how we hold people to account, how we hold systems to account, and how we allow the community to drive the solution. So Caroline and her team at Peniculicious Pacific Radio Program were doing the key messaging. We had the community dental health team out there, working with starting walking dental schools to the nearest dental clinic.
Yep.
We were doing cultural responsiveness for the non-Pacific staff. So there was a whole lot of elements to changing that system in favour for our Māori and Pacific kids.
Yeah, and look, it's just so important because losing a few teeth at that age is not insignificant, and also leads to a whole lot of later sort of life issues, which when we talk around longevity sort of actually is a risk to that, isn't it?
There is, and we have always experienced a very high level of long-term conditions for Pacific people. So this is where the disability thing comes in for me, is around one. When I started working with the disability sector out in the hut, I started connecting with Finlay Siamia, because Finlay had this regional disability role around this. The supported living payment that people would get. So you rock up to your doctor, he diagnoses you with a disability, and then he writes a letter to MSD and they put you on the benefit, you get the benefit supported living payment and a whole lot of other supports. Well, when I asked, Finlay pointed me to some data, MSD data that reflected that, and I calculated all the numbers around the Wellington region. Of a population of 35,000 Pacific people across the Wellington region, only 600 were signed up for the supported living payment. And I thought, no, there's something wrong here, because through diabetes, we have a lot of issues around amputations. So a lot of people lose their limbs, they lose their legs. That automatically qualifies them to be considered as disabled. So I would have expected that the pathway would be they go to the doctor tells them. So something in the system's not working for that number to truly reflect the number of people, Pacific people, that have a disability. My concern is that there are a lot of people with disability that aren't getting their entitlements. And so they're not getting the support, so they're not being referred to the NAS services or key coordination, where they can get even more additional support like home help and all of those things. If we're not in the numbers, we are not on the radar.
Yeah, invincible.
Simple as that.
Yeah, I just interested because you're doing work in the in that disability area and that as well as the stuff you're doing on council. I'm just thinking from a strategy point of view, and you've been doing two bits of work in those two different areas. What's some of the core stuff that needs to be part of sort of Pacific strategies that are moving across these different sort of areas?
Yeah, good question. Well, system responsiveness is going to be the biggest one. But to get there, you have to retrain and re-educate the whole system. So the staff, and this is what we've done with Your Way Kia Roha. We developed the Māori and Pacific strategies, and the CE, a clever woman, our chief executive Megan Thomas, first year was capability and capacity. So we rolled out 11 cultural responsiveness Māori and Pacific programs throughout the whole country, ran 11 of them, where Dr. Paulo Tongaro and I would go and travel to all the marae and we do Māori and Pacific training for the staff. We've done all of that. Now the second phase of that is now looking at the systems where we get our teams to partner up with Pacific providers within the community and build trust. So it's not a one-off, it's not a token gesture, it's a genuine approach to building relationships with Māori and Pacific providers, because the confidence isn't there in the relationship, because our Māori and Pacific providers are very protective of our people because they've seen what happens when it comes to mainstream services. So they're protective, but our Māori and Pacific providers don't necessarily have the resources to deliver to our whole population, nor do they have all the services. So, Your Way Ki Roha, there's 13 basic services that the ministry fund. Your Way Ki Roha has 6 of them throughout the country, and then the rest is, pepper potted around through other providers. But I know that Whakatautua don't run NASC, and they are, they have a really strong disability arm. So we've partnered with them. Our chief executives met, and now we're starting to see connections throughout our office in Dunedin and their office in Dunedin, our office in Christchurch and their office in Christchurch. And it's not just a one-off. I've made it really clear to staff, you are talking about genuine relationships that are based on trust and VAR. Started using VAR as a way of creating that trusting relationship.
Cool. Now, look, we've talked sort of the high level. We're going to change gears now. We've talked sort of strategy stuff, your stuff as a public servant and a number of sort of roles. I'm more interested now just in that personal journey. Like a lot we talk about on BST is around people's personal journeys and health and well-being, particularly when we're sort of out of our more formative active years. So keen in terms of sharing just some of your own journey in terms of remaining active and also looking after mental health and physical health.
Absolutely, and thank you for bringing that up. Although look, like everyone, I struggle, and I'm trying not to use that word struggle too much because I think that can play on our minds. I've come to accept that I'm big. I'm a big, voluptuous Samoan wahine toa, and I accept that. It's been like that all my life. I don't care. What I do care about is how long I'm going to live with this body. And so, I engaged with these awesome programs. In 2016, I did Iron Māori. I did, quite a few triathlons and duathlons. I love them because I'm really racing myself. And then joining up with Cycle Safe Porirua. We're doing 3 rides a week. That was just incredible. And Tiana, you've ridden with you as well, which is great.
Up on the beach.
Yeah. You're talking about that beach where I toppled over?
I said, follow me.
I think he is.
I didn't realise till I turned back. Oh, okay.
I was just hoping that no one was videoing that, although Finlay might have a secret video.
That was a good ride.
Yeah. So look, what I realise is I need to. There's a sense of versatility here that you can only read within yourself when you're getting. And I wouldn't say use the word. It's not being bored. It's just sort of I've done this. I need to move to something different, and you've got to recognise that early when it happens, so that you can change gear, move into a different sport. So sort of my riding, actually, I gave up my riding because my 2 e-bikes were stolen. And I was really sad about that. And so were the boys, I'm sure.
Move out of Cannons Creek.
Yeah, no, get over it and get another one. So I know I'll get back to it. I know I'll get back to it one day. So I said, right, that stopped. Right, got to get into swimming. Yep, got into swimming. I've just started gym. So it's probably not ever one thing. It's always, there's got to be something all the time. Otherwise, I can feel it in my legs. I'm walking like, I'm probably in my 90s, and that's just not me, because I've always been a physically active person regardless of my size. So look, I just want to say that, in addition to all the societal messages that women my size get about, oh no, you shouldn't be that big and blah, blah, blah. Actually bugger it, because I see this new generation of women and I just love it. They are so sassy. Our big, beautiful woman wearing these awesome clothes that reveal whatever. And I'm going, good on you, girls. Just don't wear it at church.
I reckon.
Because what the faithful and the elders are going to say. No, I'm serious. Say it's great. I think that we're accepting as a society that we come in all different shapes and sizes. Bugger bugger the models. No, they hardly eat anything. What on earth is going in that space? They're too skinny. No, I don't know that I would ever be happy with myself as if I lost so much weight that I couldn't be my jolly self anymore, because I think that's what my body, displays in terms of who I am, is being jolly, like Father Christmas.
Look, I'd like that, and this is why I was keen for you to talk about the fact that you've found multiple different activities you can do, and also that your taste sort of changes over time, but you're always finding something in terms of just maintaining that sort of aspect of your life as well. So I think that's really good in terms of a great message, particularly in terms of you don't necessarily need to get pigeonholed or siloed. You can sort of have an element of variety and still be able to look after yourself.
Yep, sounds good. Sounds good.
Sounds good. So look, in terms of any sort of final sort of words as we sort of close off, in terms of today, we've been keen to talk to you about a couple of those bits and pieces that you've done across the community in a couple of different areas, but just in terms of some final observations.
Yeah, thank you, Shane and Tiare. Look, I think it's, in terms of being leaders in our spaces, I think it's now about taking the learning and knowledge that we as specific leaders have and sharing this so people are better informed to make their own decisions. And just on a final point, I've been raised in Wellington. I heard all of those stereotype victim blaming messages about Porirua. Living in Porirua is the closest I will ever come to living in Samoa or the islands. It's home. It's where I can see a lot of my people that look like me, they talk like me, they laugh like me. In fact, if you were able to ever measure riches on being yourself and being satisfied with that, or not placing value on rich people's toys, but on relationships and values and the way we support each other, then Porirua is the richest city in Aotearoa.
Oh, you would have got your passport by now.
Hey, citizenship. I'm waiting for my citizenship.
I reckon.
Love
it. Look, Tagaloa, it's been really good in terms of the conversation, and really appreciate in terms of just sharing on a couple of particular issues from that high level, because you've been on those tables in terms of looking at this from a civil society issue and from a response across government and non-government. So really good to get your perspective, but then also it's the same, very, 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 very good in terms of just sharing that personal sort of experience and journey as well. So really appreciate in terms of time. As always, this is one down. If you come back again, you can be a friend of the pod. So I'm sure there'll be other stuff that we could definitely sort of Talanoa about as well. So I'll get Tiale just to take us out now.
Lovely. Thank you, everyone. Great to see you. Malo, love it.
Thank you, Taima. That was a very interesting journey that you shared with us. Just on closing down, those that are viewing right now, remember to like and subscribe as we build our audience, and we'll see you on the next episode. So from us to you, ka kite anō.
Mā te wā.